Well, how's this for a throwback Thursday? Check this out, 4 years ago today. Good evening. We begin with breaking news this hour. Health officials have announced the first presumptive case of the coronavirus here in Canada. It was a 56-year-old patient at Toronto's Sunnybrook Sciences Centre who became Canada's patient zero for COVID-19. 4 years later, the masks and vaccines are optional, and the virus is still with us. For more on this, we're joined by Raywat Deonandan. He is an associate professor at the Faculty of Health Sciences at the University of Ottawa. And we've been joking that we've spoken so much over the years virtually through a screen, and you're here with us. Take us back to 4 years ago and what it was like for you, especially with the work and research you do, to hear about that first patient here in Canada.
Honestly, I barely noticed. And I'll tell you why. My wife was 7 months pregnant, and I was on paternity leave, and other things on my mind.
That makes sense.
And my students were writing to me about this disease, and I thought, just let public health handle it. They've got this covered. Very quickly, it became clear that this is a different beast entirely.
That's right.
I changed my focus to it. And it was clear that this was going to be world-changing. It was clear to some of us, and that realization trickled down to the rest of the world a few weeks later, and certainly it has been.
It took on a life of its own. It ballooned out of beyond proportions that we could have predicted and lasted longer than what any of us had expected or what it was signaling. How do you think we handled it as a society or even through our healthcare system?
Well, first of all, the epidemiologists knew it would last years, not weeks, and that information didn't trickle down the way it should have. How have we dealt with it? Well, as globally, I think we could have done a lot better. Locally, in terms of Ottawa's response, I think we did comparatively well compared to the rest of Ontario, and that's due to some pretty good, strong leadership locally. Vera Etches hasn't been perfect, but she's been pretty good as a local public health leader. We've had strong medical leadership locally from the likes of Neely Kaplan-Murth and Yanni Friedoff. The academics, like Doug Manuel, have been instrumental in giving us wastewater surveillance.
That's
and
right.
The people of Ottawa have been quite compliant with the public health measures. So Ottawa historically has had a better vaccine uptake than the rest of the province.
Yeah.
That has to do with a number of factors, including our overall education level, the fact there are mostly white-collar workers here, less likely to be living in multi-generational housing, so the exposure aspects were less. We had some advantages,
right,
but also the people behaved, I think, in a more compliant way.
I've always joked with some friends who live in other parts of the world or even other Canadian cities that we're the nation's capital. This is a city of rule makers and policy makers, not rule breakers, so to speak. So it's no surprise that we navigated it the way we did. You know, a lot of people work for Health Canada and we're helping out with those policies, so to speak, like you mentioned. Do you feel that we have done a good enough job of learning to live with it as a society?
Yes and no. I think the people have learned a lot in terms of scientific literacy. Words like reproduction number are now common parlance, things that were uniquely epidemiological. So the educational curve has been rather steep. However, the misinformation and ideological divide has really impaired our ability to navigate this better. I wore a mask into this building, and I took it off to be on this interview here.
Yeah.
I'm going to get hate mail and hate tweets from both sides of the tribal camp around mask wearing,
right,
because it's so tribal and ideologically driven right now. What we didn't anticipate was the extent to which this was going to be an ideological disease, not so much just a physical disease.
Fair enough, because a lot of those ideologies are still holding true to this day, What would be your message to Canadians or our viewers even going forward in terms of what we can expect or should expect?
Right. So it's hard to make linear projections like this. As Ross Perot once said, life is a cobweb, not an organizational chart. There's a lot of factors coming at us. I think we have to stay strong and recognize that disease is still with us, but there are innovations coming down the pipeline, like mucosal vaccines. Stay up to date with your vaccines, trust in the vaccine science. Of course, have a healthy, skeptical mind and listen to your healthcare providers. But the scientists and physicians are working really hard to make this go away or at least tame it better. So stay in there, don't give up hope. The pandemic will be tamed soon.
And we've seen several mutations over the years, and I've lost count when it comes to what I call alphabet soup, when it comes to labeling the variations. Can we do away with that now? Let's just call it the virus and just get your annual vaccinations like we do for influenza, because the flu, if I understand correctly, it mutates as well, but we don't have this hyper-focused detail around it.
That's a really good point. I think you're probably right. I think for the purposes of public communication, we need to stop talking about the variants. However, we should still report on it. Information is information.
Right.
The scientists will deal with that. Just be aware that updated vaccines will now probably be a regular thing for the next few years until we get that magical mucosal universal vaccine.
Right.
Okay. But yeah, good point.
All right. Raywat Deonandan, it's so good to have you in person after speaking to you so many times throughout the years through the screen. Really appreciate you being with us and marking this 4-year milestone.
It's my pleasure. Thank you.